Right. Da, 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 da. Alrighty. Welcome to the Just for the Health of It podcast, interviews with our local health experts. I'm your host, Drew Crawford, public health educator here at Warren County Public Health. And today I am joined by Steph, Rollo, and Karla Gensch from the Glens Falls Hospital. And today we're going to be talking about probably one of the worst dinner table conversations, colorectal cancer. So if you guys wouldn't mind, go ahead and introduce yourself to everybody.
I'll let Karla go ahead.
Hello, I'm Karla Gensch. I'm a nurse at the GI Center at Glens Falls Hospital. I have my bachelor's in nursing and am a certified gastroenterology registered nurse. I have been a nurse for a little over 10 years, with most of my career being in gastroenterology. A little fun fact about myself, I have a twin sister that I hang out with every single day, and she happens to work um, in the cath lab in the Glens Falls Hospital. So, if you go get a procedure done up in the cath lab, you might think it's me, but it's not.
That's true. And I'm Steph Rollo. I'm also a nurse in the GI Center with Karla. I'm a bachelor's of nursing science, and I have my CGRN as well, which is, as Karla said, a certified gastroenterology registered nurse. I've been an RN here at Glens Falls Hospital for 25 years now. 16 of those years I've been here in the GI Center. I actually started off way back as a candy striper too. And my mother was a nurse, an RN here at Glens Falls Hospital for about 40 years. My husband was a physician here, and my sister worked here. So it's kind of, this is my family away from family, home away from home. So
Wow, absolutely. We love to hear it. And, obviously, thank you guys so much for coming on to our podcast. I know you guys are very, very busy, and we appreciate all the work that the nurses do, whether it's in a community health setting or it's in a hospital setting. You guys really, really do bring so much to the community. You guys do so much for everybody here. So thank you guys so much for taking time out of your day to come and talk to a health educator,
thank you for having us. We're always committed to the health and wellness of our community, and one of the biggest things that we do, especially this month, is colorectal cancer awareness activities. So we have a lot going on. It's a busy month for us.
Yeah, absolutely. And, obviously you said March is Colorectal Cancer Awareness Month, and it's a very, very big month. It's a big month for us here at Warren County Public Health because obviously screenings are very, very big. And before we kind of, get too far ahead of ourselves, why don't we talk about colorectal cancer? What kind of is colorectal cancer? How does it kind of start? And most importantly, what are kind of the signs and symptoms of colorectal cancer?
You want to start, Karla? You want me to?
You can go ahead, Steph.
So good to me. Okay, so colorectal cancer is a cancer in the GI tract. It starts off, usually begins as a non-cancerous polyp, and it can be detected by early screening. You had asked about some of the signs and symptoms of colon cancer, and one of the first signs and symptoms and earliest signs is that there are no symptoms. So that's why screening colonoscopy is such an important thing for people to have done. So if they advance to the point where they do have symptoms, they can have some of the things might be change in bowel habits, rectal bleeding, unexpected weight loss, some abdominal pain, or newer unexplained anemia or the low blood counts. So it's very, very important to get screened for colorectal cancer for these reasons.
Absolutely. And I mean, the screening of colon cancer is really, I believe that's kind of one of the biggest barriers for a lot of people. It's not a very fun procedure. One thing that I always talked about when we talked with Vicky Yatta and Mary Beth Fisher, when we were talking about cervical cancer and talking about breast cancer, the procedures may not be fun, but cancer is a lot less fun than just the screening process. So making sure that you can get in and get your screenings done. It's going to save you potentially a lifetime worth of, illness and not living your life to the fullest that it could be. And speaking of screenings, when should I be getting screened? One thing that we've noticed here at Public Health, granted, I'm a huge nerd and I'm subscribed to a bunch of medical journals that always pump out a bunch of stuff, and I get to read all these wonderful things. And one is a trend that I'm noticing, but I'll let you guys discuss that trend. When should people be screened? And are we seeing them in older populations? Are we seeing the cases in younger populations? What are you guys seeing?
I think I'm gonna let Karla take that one, but I just want to add it on to your previous statement that colorectal cancer can actually save your life, not just a lifetime of experience with it, but it's going to save your life. So go ahead, Karla. I know this is one she's passionate about, the age.
Yes. So in 2021, colorectal cancer screenings have now been changed the guidelines. So now they have lowered the start of the age to 45 years old. And then, of course, if you have a family history of colon cancer or colon polyps, you may be started earlier. Usually around 40, but also 10 years before your family member has been diagnosed. So if you have a family member that was diagnosed when you were like 35 years old, then you need to really be speaking to your doctor because you should be getting in here to see us at the age of 25. Colon cancer is on the rise in younger people. So it's something that I try to advocate for, that if you do have symptoms, you really should understand that, it's very important that you get screened.
Absolutely. And it's always something, it's always a tough conversation to have when it comes to cancer. It doesn't matter what type of cancer it is. It could be breast cancer, it could be cervical cancer, it could be leukemia, it could be all sorts of different things. And the hardest part to always talk about is what is the diagnosis going to be? It's very, very difficult to come into a situation where the answer very well could be yes. It very well could be, yep, it's positive. But one of the things that we always try to advocate for here at Warren County is the screenings can potentially, as we said before, save your life. It's a very treatable cancer if caught early enough. And that's why we always say test early and test often. I know it's something that we've always said. We've been saying it for about 3 years since COVID, but test early and test often. It is something that thoroughly can save your life. Now, are there any
Oh,
risk factors to colon cancer? Is there any behaviors or risky behaviors that maybe somebody listening to this is going, oh, I do that an awful lot. Maybe I should be going to get screened?
We just talked about this actually before we came on. Can I just throw a couple more statistics at you on the early screening there for the young adults? I just wanted to throw this out there before we get too far. Earlier this year, the American Cancer Society reported that 20% of diagnoses in 2019 were in patients under the age of 55, which is about double the rate of 1995. And the rates of advanced disease increased by about 3% annually in people younger than 50. So in 2023, it's estimated that 19,550 diagnoses and 3,750 deaths would be of people younger than the age of 50. So it's so important for our young folks to get out there and get screened. So we were talking about that beforehand. So do you want to talk about the prevention, Karla, things that they can do, or do you want me to?
sure, I can. So I just want to say that the link with the increase in the people that they're associating younger people getting colon cancer more, a lot to do with environmental things that we can change, such as sedentary lifestyle, overweight and obesity, smoking, heavy alcohol use, a low fiber diet, high fat diet, and diets high in processed meats. Also, other environmental factors could be, concerning. So those are linked more than just genetics right now. They're thinking that it's really a lifestyle thing. The reason for the increase.
I think with COVID too, we have a lot of people doing a lot more screen times than they used to do. We're kind of that society where we do spend a lot of time on our screens, but with COVID especially, people were kind of put in that position even more so. So a lot of people sitting around and spending a lot of time on screens, not being as active.
Yeah, absolutely. And it's really important that we bring that up, that it could be, part of your lifestyle. And for, a lot of people, I myself included, when it comes to, certain illnesses or certain diseases, you always think, yeah, but it's never going to be me. It won't be me. It can't be me because, I do X, Y, and Z, so it cannot be me.
Mhm.
And for a lot of times, what we try to tell people is you don't think anybody else thought it wouldn't be them either? You know,
Right.
like a lot of people have that same mentality, and a lot of people receive this unfortunate news. And unfortunately, a lot of it could be prevented if they took the time to go and get screened. Now,
Mhm.
for somebody who may be listening and going, listen, I'm kind of afraid of the doctors. I'm afraid of the screening process. I really don't want to get a colonoscopy done. What would you kind of say to them? What would you say to them to put them at ease and make them, go, okay, yeah, it's worth it.
So one of my favorite things to do is I have a patient, come in and they're very nervous. They don't want to be there at all. And by the end, they say, "Thank you so much. That was a breeze. It was so easy. I don't even know why I was worried." And also those moments when I can say, "Hey, I'm so glad you got in here because that probably would have turned into cancer and we got it out of you and now you don't have to worry about it." um, but luckily, these patients come in and it's one of my favorite things to do is say, "I'm so glad that everything went smooth and you're not going to have cancer now."
Yeah, the earlier the cancers are found, the more treatment options we have for these folks. So, like you said, one of the reasons that people avoid it is because they don't think they have any symptoms. They don't have any reason because they didn't have a family history of having colon cancer in their family or precancerous polyps. So many reasons of why people don't get it done. I would like to know what their reasons why are, and I'd like to be able to help address that for them. We do pre-procedure phone calls where we go through the instructions and what to expect during their visit, and we welcome them to tell us at that time, what are your concerns? What's making you hesitant to come get this done? And we're so happy that you're going to come in. So there's a lot of things that people will tell us of why they don't want to get it done or why they're hesitating. Like I said, not having the family history or not having any symptoms that make them concerned, fear, past experiences. Some people have had traumatic experiences. We understand that and we welcome you and want to make you comfortable. Every single patient who comes through here, that's our priority. They think it's a hassle to get time off from their work and the cost of losing a day's pay, especially in today's economy. So we're here to reassure them and try to make it as painless as can be and in fact comfortable and something that they walk away from, like Karla said, thanking us. So Karla's especially good at that. Our patients love her. So
Well, I'm glad to hear it. I'm sure everybody, every patient that has interacted with you guys has thoroughly, felt the care that is from Glens Falls Hospital. I mean, you guys have really, really helped out our community in more ways than we can even, thank you for. We're kind of talking about with colorectal cancer, there's a lot of barriers to, receiving that 100% screening. Is
mhm.
there, anything in particular that you guys are like, oh, this would be a very easy fix, whether it's from a policy perspective, whether it's from a community attitude perspective, saying, yes, I should probably be getting this done, or saying, we need somebody else to enforce this, or to, add a policy where people can get time off for cancer screenings and things of that nature. What kind of barriers do you guys see, whether it's from a policy perspective, a community perspective, or a resources perspective? What kind of barriers are you guys seeing to getting that 100% screening rate?
I can go or I can let Karla. Go ahead, Karla.
I I know a lot of my patients say the reason that they waited longer was due to like insurance reasons. Well, my insurance didn't cover it, so I just didn't come in. Those kind of barriers. I know that's a huge issue.
So educating them on where resources are and how they can get things covered would be a big one. And as you mentioned, I think you mentioned beforehand that our cancer screening services through the cancer center is wonderful. Making sure that if you can't afford it, they're going to try to help you get the free screening exam. But education is huge. If people can just get the word out and educate and don't base it off other people's experiences. I know it's hard because it's like women's labor stories or the fish stories. You always want to have the best stories about how yours was the most, whatever was dramatic or eventful or whatever. The worst one, the best one. Everybody wants that story, the bragging right. So don't base it off other people's stories. Just base it off your own experience. And we welcome you to come have that here with us at the GI Center.
100%. And I think that's a really important thing that you bring up is the cancer services program. It's something that we talk about an awful lot here at Warren County, and it's something that for the community is very, very valuable resource. Mary Beth Fisher, absolute wonderful person to talk to. I've talked to her maybe 3 times, and I feel like I've known her for 25 years. You know, she is absolutely super easy to talk to, and the care that you guys have, the care that you have, the way that you guys are able to, you know, take a patient's anxiety and nervousness and all of their concerns and worries, and being able to bring them back down to earth and say, hey, listen, like, it's really easy to get caught up so far into the future and think, what about this? What if that? And all this other stuff. But we got to kind of focus on right here, right now, and what we're doing. You know, you guys are very, very good at that. And we really appreciate everything that you guys do here at the county.
Thank you.
Of course. Now, you know, we're kind of talking about the screening age change. And Karla, it was really big piece that you brought up there, that screening age change, how it's affecting more younger people. Is there any reasons in particular that you think that more the younger individuals are receiving more colorectal cancer diagnoses, or is there any reason in particular, or is it just a unfortunate circumstance?
Yeah, so I really do think it has to do with obesity and sedentary lifestyles and what we're putting into our bodies. There's so much more high fats, processed foods nowadays. But, you know, that's my perception of it. They are looking into more genetics and trying to figure out, I mean, the gene pool that we actually know, you know, that there's like familial polyposis syndrome and Lynch syndrome that is associated with colon cancer. You know, they're always looking for more genes that could be affecting it, which we might find down the road that it could be linked to more genetics.
I think you're
Absolutely.
going to see a lot more research coming out on that. So hopefully we'll see a
100.
lot of research in general. But I was commenting earlier about COVID's impact on colorectal cancer screenings as well. So I think you're going to see a lot of studies that are going to look to see what are the results and the impact of that, because COVID changed a lot of our practices here. And there was a major shift that was, so you saw the non-urgent routine screening exams put off. They're put on hold to meet the pandemic regulations and to conserve and allocate our resources. And that was under the guidance of Centers for Medicare and Medicaid Services, which usually set our standards for that. So those procedures that were canceled or postponed based on that and staffing needs and those constraints. Now, you have to keep in mind that some of those people already had been putting their screening exams off and they were going to get it done type thing. But now millions of adults who are already past due and are now at increased risk of having delayed their diagnoses and their possible cancers and their treatments. So physicians had to get pretty crafty with that and prioritize their care based on the indications of the patients and using telehealth, for example. So I think you're going to see a lot of studies looking to see what is the impact of having those procedures delayed.
100%. And, you know, it's very, very interesting when we talk about the screening process, and we talk about, you know, the process that the people go through for these screenings. Is there, you know, if you wouldn't mind, Steph, just kind of talking about, what do people look for? Like, what's going on during the exam? What are people looking for during the exam? What are, you know, those polyps? How do you guys identify a polyp? How do you guys, you know, it's a colon. The inside of the body, and for a lot of people, that I don't know what the inside of a normal one looks like, let alone
Right.
you know, the inside of an abnormal one. So
Most
what do you
people
kind
know
of
it.
look for, and what are some of the things that you know, do you guys are looking for, and some of the warning signs that make you say, oh, this person, we definitely need to get this removed?
So most importantly is that we be able to see what we're doing. So that's where the prep comes in. And that's what everybody associates colonoscopy with. Oh, I have to do the prep. Oh, that's awful. I have to do the prep. And I've had people say, how do you make that enjoyable? Well, you can't put it in a pretty glass and make it great. It's not great, you know, but the idea is the enjoyment's going to come from peace of mind. And during a procedure, if we have a nice prep, we're looking in the colon for any kind of fleshy growths called polyps that are not always precancerous, but they can, if left there, you know, they can turn into cancers down the road sometimes. So we're looking for any abnormalities with that. And sometimes we're just looking to show that you have a normal colon and say, guess what? We like to give that news the best news, saying that your colonoscopy is completely normal. We'll see you in 10 years, you know. That's ideal, but we're looking for any kind of growths or lesions or any kind of just abnormalities.
Absolutely. You know,
Specimens if needed and remove the polyps if needed. So
100%.
mhm.
100%. And the big piece that we kind of talk about is obviously promoting the screenings. We're talking about it's affecting younger populations. It's not often talked about. It's not something that people talk about at dinner. It's not a easy conversation to have. Regardless of what cancer is not an easy conversation to have for anybody. And so how do you kind of open up that conversation with a patient and say, I understand what is probably going through your head, but you have to think about X, Y, and Z instead of A, B, and C right now. How do you guys kind of navigate that conversation?
You want to do that one, Karla?
Sure. First of all, I didn't know colonoscopies weren't allowed to be
I
spoken
know.
at the dinner table.
I was thinking,
In my
except
house, we
GI
talk
nurse.
about that kind of stuff.
Absolutely. Yeah,
I guess
I
it's a
agree.
nurse. But so anyways, I think a lot of people get nervous about being embarrassed, and so they don't want to go through the procedure because it would like ruin their dignity. And one thing I would say to a lot of people is that we want you to come in. Us nurses that are there, we want to help you. That's why we do what we do, is because we want to be able to prevent colon cancer. And we get to remove polyps every day. And, it's like, something that we are passionate about. So you don't have to be embarrassed in front of us. This is like something that, will help you to stay healthy. And that's what we are trying to do, is help people.
And technology has changed things. Our scopes can magnify images 30 to 60 times. So it's almost like looking under a microscope, the entire procedure. And we insufflate the colon with CO2. It used to be air. So we have to, if you think of it as a long floppy tube, we have to puff it up to C, right? Because we're putting a little headlight. We have a little light on our scope and we move along and take images and specimens as needed. But that's, what is that saying what I'm trying to say, Karla? You getting that? She's looking at me funny. She's like,
No.
the scope, they were going to go about average of about 4 feet for a larger test. And that scopes, the technology has advanced, and the CO2 makes it more comfortable than it used to be. Air, people associate a lot of time colonoscopies. I'm not going to do it because I have to lay there and pass air. Well, we have switched to CO2 to fuck things up. Your body's going to reabsorb that. Your procedure is more comfortable and your recovery time is quicker. So overall, patients are way more satisfied with it than it used to be. So technology advancement stuff help people as well.
Yes, and us nurses, we're always trying to, talk the doctors into doing anything that is, evidence-based practice that can help our patients. And that was one of the initiatives that GI nurses brought up, and advocated for to change. So we're very proud of that, right, Steph?
We are very proud of it. We absolutely are.
Well, we definitely appreciate it here in the community. Nobody likes to be pumped full of air. So, absolutely being pumped full of something that will be reabsorbed is definitely going to be a lot better for everybody else involved, I believe. So thank you guys so much. And, it's it's such a interesting conversation. When we talk about cancers, for the most part, I myself, I know that I never talked about colorectal cancer until I was in this position. I had no idea about colorectal cancer. I had no idea on the massive impact that it has on a community. And, you guys are seeing it day by day, every single day. So if you guys had to put a message out there for the community, what would that message kind of be? Would it be to promote the screenings, or would it be, to open the conversation? What would you guys say?
I think opening the conversation promotes the screenings, but it's my own opinion. I think the best screening is one that's completed. So whatever they're comfortable with. But for us, colonoscopy is the gold standard, because if you have other colonoscopy screening tests done, they may say it showed a positive, so now you have to have a colonoscopy. So you're undergoing kind of having two done that way, and insurance comes into the equation. But the best test is one that's done. Anything that gets you from A to B to the point where you get a diagnosis and the care that you need, that's most important.
And I always tell my patients to, if you had a good experience, as best experience as you can having a colonoscopy, but go tell your friends. Just go tell them it wasn't bad, and it's definitely worth it. Colon cancer can be an awfully detrimental situation to happen to anyone. So that one day of going in for your colonoscopy, you get to visit us. We're nice people. And you just go home and you finally get to eat, and it's one day out of your life compared to, colon cancer is something that could just ruin your life.
Yep.
100%.
One of our favorite topics is food, so we get to ask every single patient, where are you going to go to eat? And we can live vicariously with them. So
That's always something to look forward to. Definitely.
no kickbacks, but nurses liking food, just letting you know.
Absolutely. And, as we kind of wrap things up here, is there anything that we didn't quite get to talk about that you guys are really looking forward to do, or any last messages you have for the public as far as, what you would want to say to somebody who may be thinking, it's not me, I need to worry about it, or, I just don't feel the need to do it. What would you kind of say to them as we kind of wrap things up?
I would say it's far easier to send someone out and say, thank you for having done it with such an important test. And the people who come in, and I feel that we feel for our patients. So to have a patient come in that knew that they should have been tested a lot sooner and we're putting it off, it's hard to care for that patient and worry for them and with them, so just we experience what they do. I think that's hard. So just get your screening colonoscopy. And I know it's so one of those things, it's easy to say, but honestly, as a nurse and my friends who know that I am a GI nurse, reach out to us. I am happy to sit here after work or talk to you out in public, whatever it is, to tell you about the things that we do and whatever I can do to answer questions and alleviate your concerns. But you're going to see us out in the public, and Karla can tell you a little bit about our March activities here with the Civic Center in particular.
Yes, and I would like to say that, when you're coming in, I want to say I helped prevent colon cancer. I don't want to say, oh, I wish you got in here sooner.
Right.
We're
just happy to care for you.
So I know they're doing the Stick It to Cancer through the Thunder games, the hockey games over at this. It's the Cool Insuring Arena now. So that's going to be a nice event. So you can get some information. I know that C.R. Wood Cancer Center will probably have brochures and stuff for the community. So stop by and see us. I think we're planning on trying to have a couple nurses show up to those also. Also, every year we do a blue basket. That's right in the front of our GI center. And if you get your screening colonoscopy in the month of March, a little fun fact, you get to put your name in for in one person at the end of the month wins the basket. Us nurses always bring in blue items. It's a really fun thing that we do every year in March. And then also we always hand out I scoped you out with little facts about colon cancer screenings, and we usually attach, Stewart's always donates little coffee or ice cream tickets to us. So we love to do that for the community too. And
so you might see me running up to you at a gas station or just wherever I am on public to give you some information and share that with you. We're happy to share our education materials with our community. So thank you for having us.
Absolutely. I mean, thank you guys again so much for coming on. I know you guys are very, very busy. Obviously, it's never an easy day being a nurse, and you guys are, being able to take time out of your day to come and talk to somebody like me. It's really, really beneficial for us, and it's really beneficial for the community as well. You guys talked about the cancer screening event that you guys have during the Paint the Ice event. Very, very exciting. I would love to be there. Not only do you guys get to paint the ice, but at the same time, you can also get a screening done as well. Granted, it's not going to be a colonoscopy. We're not having colonoscopies done at the ice, but oral cancer is still just as big of a thing. And I myself, I go, we just finished up our Tar Wars program where we talked about smoking and vaping and chewing and dipping. And I know a few parents that may be listening and going, "Oh no, he doesn't know." I know, your child told me. Don't you
Yeah.
worry. Obviously go in and get your screenings done. And additionally, thank you guys so much. It's not very often that I myself get to talk to the nurse. A lot of times I get to talk to the administrators and the really boring people all the way up at the top.
We won't
But
tell
being
them.
able to connect to you guys down there, it's really awesome. You guys really have done so much for the community, whether it was during COVID, whether it was before COVID, whether it's now trying to figure out what to do after COVID. You guys have really done so much for the community, for us as an organization, and for so many other people. You guys are changing lives every single day. So thank you guys so much for coming out today.
We're thankful for the support of our administration.
You're welcome.
You'll notice that Glens Falls Hospital is lighting up for blue for colorectal cancer month. So if you see the blue lights on the hospital, that's what we're doing. We're lighting up to show the support. So we thank our administration for that also.
Absolutely.
Thank
you for having us.
Did that for us. Thank you.
Of course. Thank you guys so much. And once again, I'm your host, Drew Crawford, here with our local health experts, with Steph, Rollo, and Karla Gensch, 2 nurses here at the Glens Falls Hospital. Thank you guys so much. And thank you guys so much. Be safe, be healthy, and most importantly, be happy. I'll see you guys around here next time.